It is a very real problem. Our minority communities face disparities when it comes to health care, access, and overall well-being. Enter the Indiana Minority Health Coalition. This statewide nonprofit is doing all it can to eliminate health disparities. Tony Gillespie is the Vice President of Public Policy Engagement with the Minority Health Coalition and joins me this morning. And Tony, you and I were talking during the commercial break about how this all became apparent to you. You were working to combat HIV and AIDS.
Back in the 90s, which seems like 100 years ago, I worked exclusively on HIV/AIDS issues. I came to work for Indiana Minority Health Coalition in 1999. It'll be 22 years in October. So I started when I was 10. But I quickly found that there were so many other health disparities, that HIV was just one, and they all were unique in terms of their impact and who they impact within the minority community, all under-resourced and just all at epidemic proportion.
And you raise a very good point, because one of those areas where there are clear disparities is prenatal care. And you all have a new app, the Count the Kicks app. Tell me a little bit about that.
As we began to approach maternal child health issues, and that's always been on our radar, but just in the last 17 years, maternal mortality has become a huge issue, specifically black maternal mortality. Black women are more likely, three to four times more likely to die in Indiana just for being pregnant. Mm-hmm. And so we partnered with Anthem, the insurance provider, and we brought Count the Kicks, which is an Iowa-based organization, and they focus solely on teaching moms, families, and providers as well to count the kicks of a baby, and the fetal movement is what dictates the health of the baby. It's a great program. There's an app. You can go to our website and find Count the Kicks, ctk.org. And I'll send information here, so possibly it could be on the website here, but it's an important initiative. It's to address stillbirth, and Indiana has a significant rate.
Let's talk about the overall problem of these disparities in access. It's more than just getting the word out. We're talking about resources as well, right?
Getting the word out is important, because the outreach and engagement piece dispels the build it, they'll come myth, because that is not real. But access means something different depending on who you are, what your background is, race and ethnicity, social, economic, and where you live. Rural communities have OB deserts where, as far as 60 miles before a woman could get to an OBGYN for prenatal care. And there are a number of complex reasons that women start prenatal care late. One reason is, and it's just a disconnect, and we're hoping that we can address it. When a woman calls OB clinic and says, "I think I'm pregnant, I'd like to come in," they ask about her insurance. If she doesn't say a commercial insurance, if she says, "I have Medicaid," or I'm uninsured, then it's a different track that she takes, and that track is you have to go somewhere else to get a pregnancy test to confirm. We have to have a formal pregnancy confirmation to confirm before we can see you. So that starts a whole different odyssey. And by the time mom goes somewhere else and gets another, gets a free test, and then she comes back to make an appointment, sometimes it's the end of the second trimester, beginning of the third.
And Amber, Randy, that's just one slice of obviously what is a much larger problem. He's Tony Gillespie. We appreciate you being with us this morning.
Thank you. My pleasure. Thank you.
He had my attention so much, especially when he was talking about that Count the Kicks app, because my gosh, I actually had to go through something very similar when I was with Ledger, and I had that pregnancy-related liver condition, that I had to count the kicks to make sure that he was still moving, because they were afraid that he was going to be stillborn. And I'm telling you what, that is a tough thing to do.